if we can, let's talk a little bit about congestive heart failure. Typically, congestive heart failure is something that tends to happen as a cardiac history has advanced, correct?
Yes.
Talk to us a little bit about what CHF is and how we can identify that a little bit better.
Sure. So congestive heart failure, first of all, is a clinical diagnosis. So it's based on symptoms, what the patient has. And we have two types of heart failure. One is when the heart is weak. That is the one known as a systolic heart failure. And the second one is diastolic heart failure, which is the one when the heart contracts well, so the function is preserved.
Correct.
However, it gets stiffer, so it doesn't relax as well as it should.
Correct. So if I may just for a second, I don't mean to interrupt you, but, and I want you to keep going, but systolic is when the heart squeezes, right? And pumps blood out. Diastolic is when it sort of relaxes and fills.
Exactly.
So your heart can fail in either one of those. So congestive heart failure is sort of an umbrella term where either you have systolic failure or diastolic failure, correct? Okay, great.
Weak heart or stiff heart, let's put it that
Exactly
way.
right. But the symptoms, it's important
that
the symptoms
are the same and are going to be the same. So the symptoms, so shortness of breath, mainly with exertion, shortness of breath when patients, for example, you find that you cannot lay flat anymore, that you have to use, every day you have to use more pillows because you get short of breath, or waking up in the middle of the night gasping for air. That's also symptoms that could suggest heart failure. Swelling of the legs, that also is an important symptom.
So we have this graphic here for our viewing audience: shortness of breath, fatigue, swollen legs. You spoke about that. Talk to a little bit about rapid heartbeat. Why does that happen, and what does that necessarily mean? So
rapid heartbeat, well, patients with heart failure are prone to have arrhythmias as well. So that could be, it gets a little bit more complicated.
That's okay.
But when the heart is weak, the heart is going to try to pump faster.
Correct.
Okay.
To compensate.
To compensate, exactly. So patients sometimes can have that symptom of like my heart is speeding up without being in a normal rhythm.
Correct.
But also they can present with an abnormal rhythm, which can present with palpitations.